What if air suddenly couldn't pass through your normal airway? Sometimes doctors create another pathway, and that pathway begins in the neck. A blocked airway can make breathing difficult. Some patients also need prolonged breathing support, so doctors may create a new route for air.
That new route connects directly to the trachea. The trachea is your windpipe. It carries air toward your lungs.
Before the procedure begins, the patient is carefully prepared. The medical team monitors vital signs. Then the neck is prepared for the procedure. The surgeon carefully identifies the windpipe. It lies in front of the esophagus. The correct position is important before opening it. A small incision is made in the front of the neck. The tissues underneath are carefully separated. The surgeon works toward the trachea. Now the windpipe comes into view. Its cartilage rings help keep it open. The surgeon prepares a small opening. A controlled opening is created in the trachea. This creates a new passage for air. But the opening still needs a tube. A tracheostomy tube is placed through the opening. Its tip sits inside the windpipe. Now air has a new pathway. The tube must stay securely in position. It is carefully fixed around the neck. Now the airway can be supported safely. Air can now enter through the tracheostomy tube. It travels directly into the trachea. Then it continues toward the lungs. For some patients, the tube connects to a ventilator. The machine helps move air into the lungs. For others, the patient may breathe through the tube independently. The tube can also provide access to airway secretions. If mucus becomes difficult to clear, suction may help. Keeping the airway clear supports effective breathing. The important change is the route air takes. Instead of relying completely on the upper airway, air can enter through the neck. But breathing through the neck can change speech. Airflow through the vocal cords may be reduced. Communication may take time and support. Swallowing can also take some adjustment. Food should travel into the esophagus, not the windpipe. The healthcare team may assess swallowing carefully. Like any procedure, tracheostomy has possible complications. Bleeding, infection, blockage, or tube movement can occur. That's why close monitoring is important. After the procedure, care doesn't stop. The tube and surrounding skin need regular attention. The medical team also watches the patient's breathing.
A tracheostomy isn't always permanent. Some patients eventually no longer need the tube. Others may need it for much longer.
So that's what a tracheostomy actually creates. A carefully placed opening connects the neck to the windpipe, and that opening can provide another way to breathe. A tracheostomy changes the pathway air takes into your lungs. But what happens when the patient no longer needs it? That's another fascinating part of the story.